Hello, Talk Funders. We're here again with Lloyd and Darian, who are launching with their product Pharos. We're really going to do a backstory now about their own entrepreneurial journeys and how they've really created and are about to develop a series of products through their company, Onum. I really enjoyed the main interview and also the deep dive, which will be in the video description below. And you're a really great product that's really creating value and helping people, making sure that they take their medicine every day in a 24-hour, 7-day-a-week cycle. Fantastic, guys. Maybe we can start off the deep dive by just going, like, where did the original idea of this product and your series of products which you're launching on Kickstarter come from? Where did that come from?
Well, it started first with me being prescribed medication. It was antibiotics by the pharmacist who said to me, make sure you take all of this because it's a 7-day course and you need to take it or you can develop some immunity against the drug. So I took it the first 3 days and I felt better, and then I completely forgot to take the rest of it. About a week later, I'm seeing the bottle and I'm going, oh my God. So from that moment, I'm thinking there must be others, because I mean, I'm pretty well-balanced individual. I wonder how could I forget? So I decided to take a journey. There's got to be an easier way to help people. In so doing, I looked up and saw some of the available solutions and discounted most of them as things that people may not want to do. And continuously thinking about it, I decided, well, there has to be a way. And it's strange that my background helped me to realize that you can have a timer going without looking at a display. And that came from my aviation background, where we have, timers that will time the running of motors and engines, and you don't even know that it's happening, but it knows when it starts, it knows when it stops. So that created in my head some of the options that may be possible in designing a product that may be able to make it easier for people to perform this task. So between that and what we had, I approached Darian with the idea, and he said to me, sounds like a good idea, but I see some issues here. If you were to just have this timer going and you're late, then that lateness goes over to the next day, and you start at 8 one day, by the end of the week, you're at 9 o'clock. So thought about that, then decided there's got to be a way to fix this. And that's where we came up with restarting the clock at midnight so that any lateness of the previous day is not carried forward. When we started, we were talking about a puck-shaped device, a timer that you can actually attach to the medication bottle. Here again, innovation, thinking, well, why not just have a compartment or a device where, rather than you attach something to it, just have the device do the same thing. I mean, you've got to put the medication down somewhere. You might as well put it in this device. Will remind you what to do. And people are always looking for a simple way to fix a problem. No one wants the headache of finding new ways, reading out. You have to do this. And if you are lazy like me, you're going to find the simplest solution that will give you a double benefit. And herein the Pharos was born. And from there on, it was a matter of getting with the technical people to figure out the feasibility and the practicality of it. And Darian was very useful in that regard because he is engineer by profession. He knew how to pull these things together in terms of software and electronics. So we had a great experience building and then moving from one stage to the next. So I must say I'm happy at where we are today. And like I said earlier, there's going to be a whole lot more to come with this journey.
Fantastic. So it was real teamwork, Darian, to get this product to where it is now at the moment. You've come from an engineering background, so you were really looking at, I suppose, the build, the manufacturing, prototypes, etc., product design.
Right. Yeah. So I think when we initially started this, I was in college at the time. At least when we started to develop the kind of initial ideas of Onum and Pharos, and that was back when I was at Columbia University studying computer engineering. Those are early days of learning circuit design, but mostly software development and understanding how to work with that. We also had a team at Georgia Tech that we relied on to help build out the initial version of the product. So again, I'm in New York, Lloyd's in Atlanta, but I originally grew up in Atlanta. So used to travel back and forth between New York and Atlanta. So working with Georgia Tech was a pretty easy thing to do at the time. So that was the first iteration of Pharos that we were able to create. A few years later, we actually incorporated Onum as a company through a incubator called the Founders Institute here in New York City. So that was a very rigorous kind of incubator program, and made a lot of connections, and actually started to give Onum some legs, and started to build off of that. And then just in late 2019, we were invited to China to actually demonstrate our product, both Pharos and also some products that we have coming down the line that we're taking a look at. Lloyd, I don't know if you want to talk to that China trip at all.
Well, not specifically, but if we were to talk about the products like, nursing in particular has tremendous challenges in managing medication. In fact, there are cases out there that actually discipline nurses for having or taking cuts where they may pre-pour medicine in order to be more efficient or to cover a large amount of patients. They're not doing it maliciously, but because for them it's easier than having to remember all these various medication, the various clients, various times, and it gets very cumbersome. So what are the solutions that are available? They're not allowed to pre-pour medicine. They're not allowed to use dispensers. They're not allowed to use pill boxes, but they can keep the medication in the original container. And if they can be told when and how to use that container at point of use, then that solves a major problem. So we are looking at how we can incorporate this technology and this innovation to solve global problems in relation to medication usage.
Yeah, I think it's so much into the wider context of things. It really is. What you're like, I'm just thinking this is a trillion dollar market, let alone a billion market that you guys are trying to be part of. And I wish I had shares in your company. I think it's
you're invited. So, we will stay connected on this one.
Well, please stay connected to me in terms of the rollout of. Please come back to me again whenever you're rolling out your future series of products with your company Onum, which sounds great. But just really talking about your Pharos product today, which is pre-launch, and we're just about to launch. It's very exciting times for you. One thing that I like to say is it's amazing, Darian, that you're from a computer tech background and there's no app involved. Normally you guys like to have an app.
Oh yeah. I mean, again, as we develop products, that also definitely are in mind. I actually work at Facebook right now, so I actually do a lot of app development at the moment. So we're learning a lot, and again, if I do develop an app, again, we are all about keeping things as simple and ideally low tech as possible, especially when working with the elderly. So be on the lookout for what Onum is doing, because we've got a lot planned.
And just going back to your current, I think it's fantastic that you are launching your first product with your Onum company and with this Pharos product, which really is, as you were saying, basically saying it's really targeted to the end user. It really is targeted to those people who just basically want to either install it themselves or get help from a medical profession, which, and as you were talking about, Lloyd, it puts it into this much wider contacts of not only the end user, but really in the general medical field, you know, because increasingly people are being, the idea is for people to look after themselves in their own home rather than be, you know, put into hospitals or care homes, etc. It's just touches on so many really buttons, to use a word. It really does. It's, you know, it's a fantastic product.
Well, thank you. And to all the comments you made, those are accurate. And it's the reason why there is still $500 billion in what they refer to as avoidable costs in healthcare, mostly attributed to medication usage, because no one had found a solution that works for all. Just think about it. As you pick up your medication in the future, you'll have a display that tells you everything you need to know and do with that medication in your hand. And to have a physician or someone access that medication or that record remotely and make adjustments if necessary, all from a remote location. You feed vital signs and other information into the system simultaneously so you can see medication usage alongside your vital signs. Think of the possibilities. It's just awesome and amazing what this concept and innovation is going to be for the future.
I really am excited, because I think in one sense you're sort of giving away what your next products are going to be, and that is some market that you're going into. So please come back to Talkfunding whenever you're going to be launching that thing, because I'm thinking of a famous company that makes its own watches and how that can all be all tied in together through your devices, which you're putting into people's homes. Absolutely phenomenal. I'm very, very excited about for the future of your company, Owen. Fantastic. But let's just finish off by thanking you for bringing your first product, Pharos, which is coming live in Kickstarter, and all the links will be in the video description below. Just thank you so much. I really enjoyed this series of interview with your good self, Lloyd. And
thank you, Alan. We must thank you for the opportunity to be here and to talk about our product, because we are excited about it. And we feel that it's really going to save a lot of lives. I lost my mom under similar circumstances because this kind of product was not available. Had it been, then what she went through in her last moments would not have occurred. So there is so much emotion in this as we push forward. And we hope that, you know, we can be a solution and a comfort to many as we go forward.
Oh, on that very positive note, and which I can very much relate to, Lloyd and Darian, thank you so much for doing this Talkfunding interview today, guys. Thank you so much.
Okay,
Cheers,
you're welcome.